Hey, welcome to another Topic Tuesday. This is Dr. Mike McCall at Source Health Center. Today I'd like to talk about IBS, Irritable Bowel Syndrome. So what's a chiropractor have to do with Irritable Bowel Syndrome? Really, I wish I wasn't having to deal with Irritable Bowel Syndrome and make my life a lot easier. Not me personally, thank God, but with my patients. So with the work I do with applied kinesiology, nutrition, and supplementation, a lot of times I treat people with low back pain, and about 20% of them have a diagnosis of irritable bowel syndrome, and another 20% are probably going to end up with that diagnosis. Meaning that a lot of low back pain, a lot of joint pain that's worse in the mornings, feels better as they get going, a lot of times is not a problem in the joint, but it's a problem in the gut. So irritable bowel syndrome is a kind of considered a what we call a trash can diagnosis. And that does not serve very well in the sense of how hard your physician works to find that diagnosis. But what we mean by that is they've ruled out everything that could be serious. You know, cancers, polyps, ulcers, what have you. And if once there's nothing really salient that they can find, and yet you're having the symptoms of maybe a sense of urgency, or your consistency changes, or you have a lot of pain, or your days living around this particular condition, they give you the diagnosis of irritable bowel syndrome, which just means your bowel's irritated. One of the first things you should really consider is doing a food allergy test. In most cases, the best test that I know is you want to look for tests that do an IgA and an IgG. Most allergists will refer you to an IgE, which would be an immediate thing, like if you eat a shellfish and you blow up in red and you feel it right then and there. But a lot of times you can have a subtle allergy that just hits you hours later, days later, that type of thing. So if you need to look at that particular diagnosis and go, what is irritating my bowel? Well, if you're eating foods that can be irritating, that'd be one thing you need to look at. The other thing for just really easy digestion is try not mixing your proteins and starches. Don't mix your proteins and starches together, which is the American diet, unfortunately, of eating meats and potatoes, meats with bread like a hamburger, meats and fries. You just want to have the meat and a vegetable other than a starchy vegetable such as potato and rice. The basis of all books on physiology, which is the study of how the body works, is based on the work of Dr. Beaumont, who was a physician in Canada who basically set the stage with how we understand how our digestion works, in the sense of this is what the stomach does and the pancreas does. His research in the 1800s proved that mixing proteins and starches is very difficult to digest. So if you're not digesting your food completely, by the time it gets to the bowel, it could be irritating. Another thing to consider is water. A lot of the processes of your intestines deals with having adequate amount of water. You lose about a gallon a day. You can get good part is you can get 2 quarts just by eating green leafy vegetables. And the other 2 you should try to start drinking if you have this irritable bowel syndrome. So those would be some ways to look into it in the sense of if you've been diagnosed with it and you want to see what you can do to make yourself be better, those would be some good starts. So, irritable bowel syndrome. What does a chiropractor have to do with it? Well, a lot of times I have to deal with it because it shows up somewhere else. So a lot of times by fixing someone's gut, a lot of the back pain goes away. So I hope that helps you, and you guys have a great day, and I'll see you next Tuesday.